President Donald Trump was hit with a community note after telling reporters that 300 million people died just last year from drugs.
The president of Venezuela called the strike on the boat illegal. Are you concerned that Maduro might escalate something?
No, what's illegal are the drugs that were on the boat and the drugs that are being sent into our country. And the fact that 300 million people died last year from drugs, that's what's illegal.
So that alternative number, okay, comes after Trump announced that the military on Monday carried out a strike against an alleged Venezuelan narco-terrorist boat. So that's also 2 weeks after the president said the military had struck a first alleged drug-carrying boat in the Caribbean. Here's the thing. These are extrajudicial killings that are based on pretty much nothing. Okay. Do we know if they were carrying drugs? I don't know. Nobody really knows whether they were drug smugglers or fishermen. It appears to me that they were probably just like, hey, it's a boat. Let's bomb it anyway. We don't know if they're carrying drugs. Just blow it up. Nobody's gonna care. Look, here's the thing, though. If we're going by Trump's numbers on this, then 300 million people just last year dying of drugs would be nearly 90% of the U.S. population. I'm fairly certain that 90% of all Americans did not die due to drugs. Or, well, I'm just certain that they didn't die. Okay? So, obviously, that community note flagged the claim as absolutely impossible. Here's the reality, right? The death toll in the United States per year is 3.3 million. So that is from all causes combined, which, look, the biggest cause here, I believe, is heart disease, okay? And, you know, that doesn't have anything to do with drugs, okay? So, look, globally, 62 million people died in 2024. That's a lot of people, but it's not 300 million. Okay, so Trump's way off. Way off. Wow. Look, here's an interesting fact, though. I just want to bring it up. Okay, we actually have in the United States a lower life expectancy than other wealthy nations. In fact, we rank near the bottom. Research on mortality rates that date back to 2010, including a peer-reviewed study in the National Academy of Sciences, found that among industrialized countries, the U.S. ranks at or near the bottom of life expectancy at birth. Now, that's bad. And 2026, the average American man and woman could expect to live 75 and 80 years, respectively, while the average Western European man and woman could expect to live 77 and 83 years. Okay, respectively, according to a World Health Organization data published in 2010. I think there are some different reasons for that. Diet, exercise, lack of healthcare in this country. You have racial disparities in healthcare. You've got stress. You've got our work culture. There's plenty of different reasons, right? Plenty of different factors that make it so that, people in Europe tend to live longer than people in the United States. I think it was really interesting to bring that up because we are talking about the mortality rate after all. But as far as drug overdoses are concerned, because that's what this is talking about, right? Drug overdoses account for roughly 100 to 110,000 deaths per year. That's a lot. That is a lot. However, it has been decreasing over the years. According to provisional data from the CDC, the overall number of fatal overdoses have dropped by nearly 27% from 2023 to 2024, reaching the lowest level that we've had in 5 years, which is better. Now, we didn't do that. We didn't achieve that drop by bombing Venezuelan fishermen, okay, alleged drug smugglers. No, How did we achieve that drop? Well, turns out when you increase access to medication like naloxone or Narcan, as well as use evidence-based treatments for addiction, that reduces overdose deaths. But guess what the Trump administration has done to those programs, to that funding? They have gutted them. Ah, yes, that's true. Last month, for example, the Trump administration demanded that Congress cut an additional $26 billion from addiction and overdose services in the federal budget through the appropriations process over the next few months. And it's estimated that Trump's One Big Beautiful Bill alone will cut 156,000 people off from access to medication for opioid use disorder and double the overdose rate among that group. Again, these are people in, for example, middle America, all right, that are, hooked on opioids because of the Sackler family that got away with nothing. No, they got away with everything. They got no punishment whatsoever, scot-free. Doesn't matter that they're not going to prison. Those groups here, those people, I should say, in that industry, in the pharmaceutical industry, just got away with everything. Okay, that's what happens with giant corporations. But anyway, here we have, okay, so many people, the victims being cut off from these life-saving medications and addiction programs. Okay, 156,000 people. They're going to lose their access to this medication. And around 1,000 additional overdose deaths will now occur, or at least are expected to occur among this group. As of July 16th of this year, the Trump administration and Congress have also slashed about $345 million in federal funding that supports treatment, overdose prevention, and other health services, and about $588 million in drug-related research. So what we're getting here under the Trump administration, under Republican rule, is more extrajudicial murder of fishermen in boats, while also gutting funding for programs that would help cut the number of overdose deaths. The result, obviously, is more death because they are a cult of death. More death among Americans, more death about suspected but not proven drug traffickers. And even so, even if they are drug traffickers, I don't believe that that should be a capital offense. The Trump administration's response to this is exactly the kind of response that does not solve this problem. Drugs and drug deaths are a problem. Smuggling and trafficking are a problem. But you can reduce that problem or even eliminate that problem by getting rid of the demand. Okay? The demand for the drugs. That's what drives smuggling, is people in America want the drugs. And so they're willing to pay for the drugs. And so you have people that are willing to traffic the drugs. Okay? That's it. If you find ways to eliminate the demand for those drugs, along with providing perhaps comprehensive treatment programs proven to work, along with access to life-saving medications like Narcan, naloxone, you save lives. You save lives, and you save money. But this administration does not want to do that. They would rather use bombs to punish people because that's what they're about. They are about punishing people who use drugs, who fall into despair and get addicted. And they also want to punish the trafficker, the person that brings them the drugs, with lethal force, which again is not going to solve the trafficking. It is actually going to make it more dangerous. And it's going to be counterintuitive, you see, because the more dangerous it gets to traffic the drugs, the more expensive those drugs are going to be, the more people will be willing to pay for them. And therefore, it will be even more lucrative for those who try to brave this, the U.S. response to try to get those drugs into the United States. That's what's going to happen, okay? You're going to make it even more attractive for drug smugglers to ply their trade. You're not solving the problem. You're just making the problem even worse. It's counterintuitive, but what do you expect, again, from this administration that does not care at all about facts? Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.